Okay. Hi, my name is Gabby. I'll be your student nurse today. Can you please state your name and date of birth?
Lauren Marks, 10/14/2004.
Okay, perfect. Hand hygiene. Okay, so today I'm going to be doing an assessment of the head, neck, eyes, ears, mouth, nose, and throat. So first I'm going to begin with the head and neck. So first I'm going to just observe the face. So I'm going to notice the eyebrows are symmetrical, the eyes are symmetrical, the nose is midline, and then the lips are also midline. Okay? And then next I'm going to observe cranial number 5, which is a trigeminal nerve. So can you please clench your teeth? Okay? And then I'm going to palpate the area around it. Okay? And then next I'm going to grab a cotton ball. Okay? Can you please close your eyes? And then just let me know when you can feel the cotton ball.
No.
Okay, perfect. Next, I'm going to test cranial number 5, which is the facial nerve. So can you please smile, frown, close your eyes really tight, raise your eyebrows, and purse your lips. Okay, perfect. Cranial number 7 is intact. Okay, next I'm going to palpate the scalp. So I'm just going to notice the hair distribution, the texture, and then I'm going to part the hair and look for any lumps or lesions underneath. Okay, perfect. So next I'm going to palpate the facial and maxillary sinuses. So I'm going to do the facial. Do you have any pain with that?
No.
Okay, and the maxillary, any pain? Okay, perfect. I don't notice any tenderness or swelling under that, so that is good. And then next I'm going to palpate the TMJ. So can you open your jaw like that? Okay, so there's no clicking, so that's good. And then next I'm going to inspect the neck area. I don't notice any abnormal veins or abnormalities around the neck area, so that's good. And then I'm going to palpate and auscultate the temporal arteries. So first I'm going to palpate both sides. Okay. And then next I'm going to use the bell side of the diaphragm to auscultate. Okay. And I don't hear any brewing signs, which is good because that's a sign of an abnormality. And then next I'm going to palpate the thyroid gland, the trachea, and the lymph nodes. So I'm going to palpate the trachea. Okay. It is midline and no bumps or anything. Okay, and next I'm going to palpate the thyroid gland. So I'm going to move the sternocleidomastoid mastoid muscle out of the way and just palpate that area. Okay, and then I'm going to do the same thing on the other side. Move this out of the way and palpate. Okay, next I'm going to look at your lymph nodes. So I'm going to do the preauricular, postauricular, occipital, jugulo-digastric, submandibular, submental, superficial cervical, posterior cervical, and then deep cervical. Okay, and then keep like this. And then subclavicular. Okay. And then next I'm going to assess cranial nerve number 11, which is the accessory nerve. So can you please shrug your shoulders? Okay, and then do it against resistance, and then look to the left and look to the right. Perfect. Okay, cranial number 11 is intact. So next I'm going to move on to the mouth, nose, and throat portion. So I'm going to observe the outer parts of the nose and palpate it. Okay, do you have any pain with that?
No.
Okay. Next I'm going to look at the internal part of the nose. Okay. Okay. Perfect. I don't see any redness, swelling, or polyps, so that is good. And then next I'm going to look at the lips. They are moist, not cracked. They're a nice pink color. Okay, and then I'm going to observe the floor of the mouth, the buccal mucosa, and yeah, okay. So open your mouth. Okay, there's a nice pink color, no signs of whiteness in the mouth, and then can you lift your tongue up? Okay, perfect. Okay, And then next I'm going to look at the teeth and the gums and also the tonsils. So can you show your teeth again? Okay. They're clean, nice and white, and there's no swelling around the area. And then, can I see your gums again? Okay. Okay, and there's no signs of gingivitis, so no redness or swelling, so that is good. And then next I'm going to look at the tonsils. Can you stick your tongue out? Okay. Okay, I see no signs of any tonsils, so that would be a +0 rating. Okay. Next, I'm going to test cranial nerve number 12, which is the hypoglossal nerve. So I'm going to put glove on. And I'm going to grab this. Okay, so can you please stick your tongue out? Okay, and then I'm just going to grab it and move it to the side. Okay, perfect. I don't see any abnormalities under the tongue area and no signs of any bumps or redness on the tongue. Okay, and then also I'm going to test cranial nerve number 9, which is the glossopharyngeal, and number 10, which is the vagus nerve. So can you stick your tongue out and say ah? Okay, and I noticed the soft palate rising, so those cranial nerves are intact. Okay, next I'm going to move onto the eye portion of the health assessment test. So first I'm just going to observe her eyes. I'm going to feel the lacrimal gland. Okay, there's no swelling and there's no excessive dryness or tearness, so the lacrimal gland is intact. The eyebrows are full, symmetrical, and the eyelashes are full and lifted. Okay, and then there's no swelling around the eyes or anything. And then I'm going to look at the conjunctiva and the sclera. So I'm just going to have you look up and pull down. Okay, the sclera is a nice white color and the conjunctiva is a pink color. So next I'm going to look at the size of your pupils. Okay, so they are pupil gauge 4 on both sides. Okay, so the first test I'm going to do is to test cranial nerve number 2, which is the optic nerve. Okay, so I'm going to have you do the Rosenbaum test. Let me stick this out. Okay, and then cover one eye and just read the line that you can read.
374258.
Okay, now switch sides and read the line that you can read.
374258.
Okay, perfect. Okay, next to test cranial nerve number 2, the optic nerve, I'm going to do the peripheral field test. So I'm going to have you close one eye. Okay, and then I'm going to close that same eye, and then tell me which finger is moving.
The top one.
Okay.
The bottom one.
Okay.
The top.
Okay, now switch eyes.
The bottom. The top. The top.
Okay, perfect. Cranial number 2 is intact. So next I'm going to test cranial number 3, which is the ocular motor, number 4, which is the trochlear, and number 6, which is the abducens nerve. So first I'm going to do the light reflex test. So I'm just going to shine this in your eyes. Okay. And I can see the light reflecting in both eyes right in the middle of the pupil, so that is good. And then next I'm going to do the cover test. So I'm just going to have you stare at my nose, and then I'm just going to cover your eye and remove it. Okay? Okay, perfect. Okay. I don't see any abnormal movements in the eye, so that is good. And then next I'm going to do the 6 fields, the 6 cardinal fields test. So I'm just going to have you follow my finger. Okay, perfect. Again, no abnormal eye movements, so that is good. And then next, I'm going to do the consensual and direct light test. So I would have the lights dimmed, and then I'm going to take a pen light and I'm just going to shine it in your eye again. Okay, so I'm just going to go over. Okay, this side. Okay, and then when I do that, I see the constriction in the one eye for the direct test. And then when I did the consensual test, I can see the constriction in the other eye, so those nerves are intact. And then lastly, I'm going to do the accommodation test. So I'm just going to have you follow my finger in and out. Okay, okay, again, perfect, no abnormal movements, so that is good. And then lastly, I'm going to use the otoscope. Okay, and I would also have the lights dim for this, so I'm going to use my right eye against her right eye in my right hand. So what I'm looking for is a red light reflex, and then I'm also looking to see the optic disc in the back. So I'm just going to find lights of eye, follow it in. Okay, and I'm going to do the same thing on the other eye. Left eye, her left eye, in my left hand. Okay, perfect. I can see that the eye, or the optic disc, is a orangey yellowish color, and I can see the retinal arteries, and those are all intact. And lastly, I'm just going to check for perla, so the pupils were equal and they reacted to light, so that's good. Okay, lastly, I'm going to do the assessment of the ears. So first, I'm just going to feel the outer part of your ears and just observe them. Okay. Perfect. There's no lesions or lumps on either side of the ear, so that is good. And then next, I'm going to use the ophthalmoscope. I'm going to hold it at this angle, and I'm going to pull her ear up and back since she's an adult. I'm just going to up and back. I'm going to look in there. Okay, I see a little bit of wax, which is normal, and I also see the tympanic membrane, which is a nice pearly gray color, which is normal. I'm just going to reach over you. Okay, I'm going to do it on the other side. I'm going to lift up and back. Perfect. Again, I see the tympanic membrane is a pearly gray color. And I can see all the other structures on it, which are normal. And then next, I'm going to do the whisper test, which tests cranial nerve number 8, which is the acoustic nerve. So I'm going to stand behind you 3 to 5 feet, and can you massage your tragus? And then I'm going to say 3 letters and 3 numbers, and you just have to say them back to me. Okay? So,
A, K, T.
Okay, I'm going to do the same thing on the other side, so just massage your tragus. Okay.
1, 4, 6.
Okay, perfect. And then next I'm going to do the Weber test, which tests for lateralization in both ears. So I'm going to activate this, and I'm going to place it on your head, and you just have to let me know if you can hear it in both sides laterally, or equally. Okay, so.
Yeah.
Okay, perfect. And then next I'm going to do the Rennie test. So I'm going to activate it, and then I'm going to place it on the mastoid bone, and then once you can't hear it anymore, I'm going to move it to the front. So just let me know when you can't hear it anymore.
Okay.
Okay, perfect. So the airway should always be 2 times longer than the bone conduction, which that was. So that is good. Okay, and that is the end of the assessment. So thank you for your time. And do you have any questions?
No.
Okay, and that is all.